Hello, everyone. Great that you're all here. I'm happy to talk about the ethical considerations of using real-world data for research purposes in the field of pregnancy and lactation. Um, my name is Marieke Hollestele, and I'm a PhD student in bioethics at the Department of Bioethics and Health Humanities at the UMC University Medical Centre Utrecht. And together with Rieke van der Graaf, Mirjam Sturkenboom, and Hans van Velde, we worked on the ethics of a learning healthcare system for pregnant and lactating people. And this PhD was also, of course, part of the Conception Project, which is the organizer of today's webinar. And yeah, I will be talking about the ethical considerations, and I want to emphasize that we looked at it from the perspective of a learning healthcare system that utilizes real data. If you can go to the next slide, please. So as Miriam already explained a little bit, a learning healthcare system in our view is a system that integrates care and research in such a way that it can facilitate research and improve research and accelerate research and outcomes for patients and their healthcare providers. And below or next to the quotes, you can see a simplified version of a learning healthcare cycle. Yeah, the idea is that such a system is, of course, bound to have a good data infrastructure, and data are key. And as we have seen or heard from Miriam, real-world data are being extracted from a vast collection of data sources. The idea that a learning healthcare system could enable that is, of course, great in the field of pregnancy and lactation. So at the beginning of this PhD project, we started from the idea that combining this LHS approach with the utilization of real-world data is an interesting way forward for knowledge generation on medication safety and pregnancy. If you can go to the next slide, please. Real-world data are receiving a lot of attention, and they have promising prospects. In general, compared to randomized controlled trials, it has been argued and shown that real-world data analyses have the potential of saving both time and costs, which would also mean that new insights and relevant information on the safety and effectiveness of many treatments can reach patients and healthcare providers more quickly. And with that, it could also evaluate drug effects in populations that are often excluded from randomized controlled trials. If you go to the next slide, please. And this is where the IMI Conception Project comes in. It taps into this idea of utilizing real-world data and doing that within this huge collaboration that brings together all different data sources, pregnancy and medicine cohorts, registries, and research groups that all have unique data regarding pregnancies, adverse drug reactions across Europe. And yeah, Conception has similarities with the idea of this learning healthcare system. And using real-world data in this way could be a good way forward. But it also, of course, poses some challenges, which has to do with the heterogeneity of the data and the different rules and regulations of countries regarding the handling of use of data. And if you go to the next slide, and often mentioned regarding the challenges of real-world data is the question of the quality of data. Real-world data are often used for other purposes than they are originally collected for, and also by people who are not trained in data standards, and thus it may lack some information for some critical endpoints, or they do not capture the complete clinical experience. And you really need resources, experts to be able to work around this and also work with real-world data. And I think today is going to be an interesting day to hear about the experts in IMI Conception Project, how they see working with data quality and how to deal with maybe the challenges real-world data are posing. If you go, yeah, thank you. So I will now go over some of the ethical considerations. We have identified some of the most pressing ethical considerations. I cannot talk about them all as much as I would love to, But I also want to emphasize that ethics is not only about reflecting on what we're allowed to do. Of course, we have rules and regulations, a lot of guidance for some processes, but there's also a lot of ideas are still being developed, or guidelines are being developed, because the utilization of real-world data is also fairly new. And with the ethical considerations, we really want to raise attention to the question: if we want to use real-world data, how should we do this in an ethically responsible way, or how to do better, so to say? So first, it's important, of course, to protect or respect the individual interests and autonomy of data subjects, or in this case, pregnant or lactating people, which is challenging and often leads to the question about informed consent procedures for the use of real-world data. Although the de-identified or anonymized data does not fall under the protection of the GDPR and does not always require, for example, traditional informed consent, empirical evidence suggests that many patients, or also pregnant people, expect some form of consent for research, or are even sometimes a little bit uncomfortable with de-identified research, especially with the existence of privacy risks. And this was actually also underlined by our own qualitative study. So perhaps we should be thinking about asking broad consent at the source of data collection. Broad consent is often typically used to obtain individuals' consent for the storage, maintenance, and secondary research use of identified private information or biospecimens. But it could also be relevant in the context of real-world data, because it allows us to inform patients as well about the collection of their data and the potential use of their data without having to ask consent for every single study. At the same time, engagement of people, of pregnant people, lactating people, is also very important for understanding their preferences and worries regarding the use of real-world data, and also in terms of returning results to them in an understandable manner is crucial. Go to the next slide, please. Closely related to this topic are also trust, transparency, and responsibility. Trust between data controllers, researchers, physicians, patients, in the way that data is used and the knowledge that is being generated with real-world data. Furthermore, although some research processes, such as formal observational research using electronic health records, for example, are subject to external governance by some institutions, for example, by ethics committees. Other types of uses of real-world data are largely self-governed. And on the one hand, this self-governance is quite useful. It's flexible and rapid in responses to some issues. However, they also lack transparency and can undermine actual trust and raise questions about the legitimacy of self-governance by these institutions or large collaborations. Transparency also ensures that data subjects, but also physicians, are aware of how their data are being used and for what purposes. And decision makers can also check the quality of and applicability of these generated results. And although it's, of course, the responsibility of the organizations who collect and store real-world data to have appropriate structures to ensure, for example, transparency, some people suggest that it might be a good idea to install a data access committee that guides specific conditions for data collection access, but also requirements for authorships or acknowledgements, citations, collaborations, which in such a large project as IMI Conception could also be a good idea. And lastly, transparency, trust, but also respect for autonomy. They also depend on a sense of moral responsibility towards data subjects, or basically the people behind the data. And this ethical data handling is very much a responsibility of people who are using the data for all sorts of purposes in all sorts of stages in real-world data analysis. Next slide, please. We also need to take into account the diversity amongst pregnant and lactating people. They're a very heterogeneous group. An example, maybe not the most occurring example, are trans men who fall under the group of pregnant people, maybe not traditionally, but even less knowledge is available to those pregnant persons. And with that, it is very important to also use inclusive language when doing research or sharing information to pregnant people. Also, certain types of real-world data may be heavily biased and unbalanced towards certain groups, being not diverse and inclusive. And it's essential to check before using data whether databases have been inclusive and responsive to the true health needs of different pregnant persons, or to be mindful of the limitation of for diversity. And lastly, real-world data analysis should also be responsive to the true health needs of pregnant and lactating people, meaning that research should address their priorities and wishes, and to know their priorities and wishes. Equal partnerships or community engagement is essential. And I think, or I hope that it becomes clear through this presentation that the engagement of pregnant people may be very valuable for so many different reasons, for valuable data collection, for trust and transparency, for respecting their autonomy, but also understanding what it is that they need when developing such a learning healthcare system. Next slide, please. Using real-world data does not come without risks, especially considering the challenges around real-world data. They are messy, incomplete, sometimes unstructured. And there's always, of course, the fear and the possibility that data might be used for other purposes than earlier agreed upon. We also have to remain critical towards the interpretation of findings. Real-world data and real-world data analyses are not yet information, and to be able to transform that into useful information, which can be used in the clinical practice, might also be quite challenging, especially when individual translation remains limited because of the use of aggregated data or because biased methods have been used. And again, transparency here is very important to be able to check this quality of both data and methods. And on the one hand, using real-world data allows us, of course, to study populations who are oftentimes excluded from randomized controlled trials. But on the other hand, again, certain types of real-world data may be heavily biased or unbalanced and might even exacerbate disparities. And one last point, sorry, is to also make sure that the risks and benefits are, of course, not for only one specific group. To give a very concrete example, when it comes to presenting new information, they should at least be accessible to all pregnant persons. Next slide, please. Lastly, to fully embed real-world data in the field of pregnant people, all relevant stakeholders must recognize and embrace the need for this added value of real-world data, that they are really crucial in the sustainability of it. Not only scientists, but also pregnant people themselves, physicians, boards of directors, data managers, health institutions. They all need to help incorporating this real-world evidence into this system of continuous learning, and should be willing to. Another way of looking at sustainability is by looking at methods that can help improve the quality of data by providing, for example, feedback on how data should be collected. So also feedback to, for example, healthcare providers, how they should collect health data in a way that is actually useful for research. Last slide, please. So I think it is safe to say that real-world data is an increasingly important part of the clinical research landscape. And although I have not gone into the question of whether real-world data would be the most promising way to generate knowledge for medication safety in pregnancy, given the status quo and the attempts for the fair inclusion of pregnant people in clinical research, we should take the proven ability of real-world data, of course, very seriously. And I hope that people, healthcare providers, to help improve data collection and increase the confidence and to earn trust. So with that, I would like to end with several steps that I think are very important in thinking about using real-world data. We should create awareness on the use and potential of real-world data and we need other people actually to help us explain how real-world data can be used. Like webinar today is a great example. We need to engage pregnant people. We need to avoid biases, of course, and maybe rethink the informed consent procedure, and think about ways to also improve the quality of data. But I think today's webinar will be enlightening on that aspect as well. Thank you very much.